My name is Nisreen Alwan. I'm an associate professor in public health at the University of Southampton. So I work in public health. I teach public health to postgraduate students, but also I do research in public health. And my research is currently actually focused on two main areas. One, which I've been doing for years, which is around really how risk of having chronic conditions later in life, things like obesity, eventually heart disease, how is it shaped very, very early on in life, in childhood or even before childhood, early years, pregnancy, or even before pregnancy, and how we can prevent the development of chronic disease through that very, very early prevention and understanding what factors help shape that most, and also trying to reduce inequalities in health later in life on a population level by actually tackling health at that very early stage in the life course. And then in the pandemic, I doing more research now on COVID and specifically long COVID, again with really a similar angle of trying to reduce inequalities and how people are affected by this serious public health problem, which is kind of ongoing illness following COVID, and how we can reduce inequalities in terms of the care and the support that they need, and eventually, hopefully, recovery for most of them. Well, I've engaged with policymakers, I guess, in different ways. Some of them direct through letters and giving expert evidence in sessions around the pandemic, but also some of them through public platforms, through things like social media. For example, I use Twitter a lot, and putting in kind of the expert input on that, the evidence around it, but actually trying to formulate it in a way that is concise and clear and short for policymakers to look at that as well. And I have interacted directly with policymakers like MPs on social media. I guess what really sparked my specific interest in long COVID is experiencing myself, having personal experience of long COVID. And I started really talking about it, putting these two hats on at the same time, which is the public health academic and scientist, as well as the person with the lived experience of the condition. And that started in July 2020. And I felt at the time that I had to share my personal experience because there were all these anecdotes about long COVID, but there wasn't anything systematic about it. There wasn't much in scientific journals. Definitely there was not much in the policy domain and communication. And I brought in the need to actually quantify this condition, not just quantify hospital admission and deaths from the pandemic, but actually the chronic illness that this virus is generating. So that was really through trying to put those proposals into scientific journals, but also doing a lot of advocacy, through the media, through the social media, through obviously engaging with policymakers whenever I had the chance. And then we started doing research on long COVID, describing it, what it looks like, for people, how is it affecting them, the symptoms that they experience. And actually the research, got expanded. I'm particularly focusing now on looking at inequalities in long COVID because we know the pandemic affects different parts of the population differently. That's both the direct effect of the virus and the indirect effect of the pandemic. And long COVID is not going to be any different. People who are for more disadvantaged groups and backgrounds, social, economic, ethnic minorities, they would be affected more by it. And we're trying to look at that, look particularly at things like stigma attached to having that condition in this context that we are, in terms of the pandemic, and what does it mean for individual people in terms of the care, the support that they need, and the recognition they need, not only in healthcare, but wider recognition in society and in their jobs and employments and benefits and livelihoods. I recently joined the Public Policy Southampton Strategy Board. I'm really pleased to join this group. I did this because I suppose several things. One is I'm a true believer in engagement and policy, and that's why I'm in public health. You can't really have public health without engagement with policy, and I think that can go for different levels. There's the international level, national, but also the kind of the regional, local level, with Southampton being a civic university, and how we can engage with the public health teams and the wider teams on the ground locally. So I wanted really to bring in our experience in public health and how we do that, also our pandemic experience of how we've engaged widely. But also, I'm also passionate about diversity, equity, really hearing different voices from different backgrounds, and how we can, if I can help in any way to kind of diversify the voices from the university and beyond, in terms of how the university engages with the wider society and policy, really hearing from the people we don't normally hear from, because we've got some great and wonderful minds in the university, and it's really about trying to open up that space for them to engage more. I have also engaged internationally with health policy leads, such as the World Health Organizations, in actually trying to raise awareness about long COVID and try and move the agenda forward in terms of defining this condition, and so that people need a definition of that condition, and the vagueness around it doesn't help in everyday life, and actually trying to do that on an international level with the WHO, in terms of providing that guidance to countries, and particularly, countries, low and middle income countries, in terms of trying to recognize and characterize this condition a bit more. Based on my experience, let's say, maybe not strictly advised, sometimes that there is a message that needs to be communicated strongly to policymakers, because this is your area of expertise, from your training, from research, this is something that needs communicated. And I think it's about really distilling this message and being brave about saying it, and saying it in a clear and concise way, not necessarily attached to books and pages of evidence as we do in academia, because you've done all of that already. So you just put it out there, and have the courage to actually kind of keep repeating it. I think that's the other thing. That's what I did based on my experience. I sometimes repeated messages, things like count long COVID. We had a hashtag on social media for it. To me, it felt like I'm being a broken record. I keep saying the same thing over and over. Actually, that was needed to reach a wider audience, including all those policymakers. The other piece of advice is perhaps try using social media to communicate these messages you want the policymakers to hear. Social media, specifically Twitter, that's the one I've had experience with, can be a double-edged sword. But it is definitely powerful in getting your message out there, because most of the policymakers are on Twitter. And if you say your message and say it again, and it reaches a wider audience, some of that audience will be the policymakers, and they'll start listening to that, and perhaps then reaching out and interacting with you around what needs to be done and asking for your advice.